Hello and good morning, everybody. Welcome to our monthly broadcast. It's all in your head. We are going to talk about optimal performance training, and we couldn't get a better professional discussing this topic with us today. We are here with Hiroko De Michelis, who recently joined our clinic all the way from Italy to lead our division Precision Neurometrics. Precision Neurometrics focuses on developing and maintaining optimal brain functioning, mainly for executives, athletes, but also singers, dancers, and other performers. Hiroko holds master's degree in psychology and also positive psychology. She's trained in observed and experiential integration, mindfulness-based approaches from Bangor University in UK, and REBT cognitive behavioral therapy from Birmingham University in UK. Hiroko is also board-certified neurotherapist. She has been practicing in the field of optimal performance with elite executives, children, and individuals wanting to achieve their potential. All right, we are going to have 2 breaks during this webcast so we can answer your questions. You can send them to us through the chat feature located on the control panel on the right side of your screen. So without further ado, I'd like to welcome Hiroko De Michelis. Good morning.
As Rita mentioned, I have the privilege to lead the newly launched Precision Neurometric division at the Swingle Clinic, which actually engages with something called optimal performance. And I would like to see with you and outline what we mean with optimal performance and with optimal performing brain. Now, let's have a look. What do we mean with optimal performance, optimal performing brain? We mainly mean having a brain which is flexible. So that was a good occasion this morning, for example, and being able to produce calm and relaxed waves, and yet alert waves. So we're not only talking about a state of relaxation, we're only talking about a state of focused concentration and the ability to actually reflect appropriately before action. Another assumption that we're going to assume during our discussion is the concept that talent can be optimized, which again doesn't mean we often use the metaphor at the clinic of the Beetle car and the Ferrari. We're not saying that we're training individuals so that the Beetle car will then eventually beat up the Ferrari. We're saying given each one's characteristics, we really believe, and we know from science, that those characteristics can be shifted onto a higher level of functioning. Now, before going back to the real core of the discussion, I would like first to make some important points before starting. First of all, and I'm going to repeat that throughout the webcast, one of the most important points that we want to make is you're going to see around many franchising, many practices actually providing sort of protocols that apply to everyone, so the concept of one size fits all. Well, we would like to point out that we don't believe in that modality, and we really think that procedures should really be custom made, and that relates to the second point, which actually argues that no strong effects can actually be achieved without strong counter effects. So we need to tailor, shape the treatment, the interventions, the training according to the person's characteristics, both in terms of brain waves and of physiology aspects, which we're going to discuss later. And again, this leads us to the third point, which is actually the fact that everyone seeking for neuro treatment, neurotherapy, or biofeedback treatment should always seek the assistance of a certified, well-trained, and supervised practitioner. I think the golden standard for a certification is BCIA, so the institution which is certifying practitioners, and you can find many informations onto their website. They have a list of certified practitioners, and I really encourage everyone to seek for the assistance of a certified trainer. Now, as Rita mentioned, optimal performance, optimal brain functioning relates and addresses several categories of potential clients. So if we're speaking about the brain operating at maximum efficiency, we are talking both about athletes and helping them into achieving a peak performance. We're talking as well about elite executives, and we have worked with them for a very long time. And in that respect, we're talking about maximizing their competence and their effectiveness, so that we also can see a return on investments and on the actual capability of the corporation to be stronger in terms of results. We also address artists, performing artists, singers, dancers, actors, so the capability to deliver a creative performance. And again, we're also talking about age-related decline, so issues related with slowing in alpha frequencies. We're also going to discuss that, and also army, so interventions which could relate to preparation for duty, but also soldiers that are coming back from the battlefield and need to fix their emotional scars. So all of those are potential clients. Now, what do you train? Well, to put it very simply, you train a state which is attentive, which is calm, and which relates to a state of focused readiness. That's just to simplify and to make 3 easy points. And we're going to have a look at 3 areas of intervention. We're going to focus on optimal brain waves. We're also going to talk about self-regulation training. And we're going to speak about the 3rd stage, which is maintenance of that optimal state. So in terms of optimal brain waves, I have subdivided that part of intervention into 3 subtypes. And the first stage is actually identifying what we think are inefficiencies in terms of brain waves. Now, an inefficient brain often has too much slow activity. So this is now a spectrum analysis of the EEG, and we see towards the left side of the graph actually an extra activity in the slower ranges. So I'm talking about frequencies sitting at around 6, 7, 8 hertz, and we see how that's really, really bumpy in that range. But I'm also saying that an efficient brain is also a brain that could be too fast in other frequencies, which we know could be related to other issues. So this is another way to looking at EEG. This is what we call 1 hertz bins, and we look at in an Excel sheet onto frequencies band by band, and we actually see that if you follow my arrow, I'm not sure if you can see my little arrow moving, but we see like bumpy area over here sitting at around 23, 24 hertz. Okay, so that's another way of looking at brain EEG. Okay, so we were speaking about now measuring. There is a whole issue of assessing, because we have discussed about the importance of custom-made and tailor-made, tailor-adjust the assessment to the person. So what we use at the Precision Neurometrics division is actually an assessment which is exclusive which is proprietary of the Swingle Clinic, and it's the clinical IQ.
Okay, so we were talking about the clinical IQ assessment, okay? And it will be interesting to have a look at my own brainwaves and Rita's brainwaves at this stage. Maybe they're becoming a bit faster, okay? Trying to troubleshoot the problem and trying to give you a good webcast despite the technical issues. Okay, so what we do in the clinical queue is we're looking at several areas of the brain. So we actually position the sensor onto 5 different locations, and we have then markers which help us identify what we consider inefficiencies. And those inefficiencies relate to cognitive and emotional conditions, such as sleep quality, depression, anxiety, rigidity, extreme rigidity in thinking, substance dependence, or mostly can also happen mental fog and sluggishness. Now I would just like to briefly present a case study, because it's always interesting to have a look at real examples. And this is a dancer which I met in London. He's a ballet dancer. This person is a young man, 21 years old. And he actually came to consult me because he was preparing himself for an audition, a very important audition. And by a more thorough intake, we also realized that, so it revealed that he had some sleep problems, he had some restlessness, anxiety, could not concentrate in remembering the routine that he had to learn, and his performance was being compromised. So what we ran a clinical queue, and this is what we actually saw. So the way how you give the feedback to the client once you've done the clinical queue is desirably always based on potential, is desirably always phrased in a positive way. So you would like and want to reward the client for his positive characteristics, and you would like to speak of inefficiencies and potential for improvement rather than problems or things that cannot. So the first thing we see, and we will also see it in the next slide, we're now looking at CZ, the central part of the cortex. We see what we often see in artists, in performing artists. We see something that we call the artist signature, and that is seen in the alpha response when the client closes his eyes. So normally we expect an increase of alpha. When someone closes his eyes, we actually deactivate the visual cortex and the brain starts visualizing. And so alpha is related to that ability to visualize, and normally we expect an increase of 30% at the top of the head and almost 50%. What we see here is actually a very big increase. So we see a 113 increase in C, and we see 313 at O1. So that's something quite common when working with artists, with performing artists. So you would like to reward that characteristic. But also in terms of, we've spoken about inefficiencies and potential for change. Now we have a marker here that is theta to SMR. And that marker is speaking about the ability to be bodily quiet, the ability to actually have also very good sleep qualities, normally related to restlessness during sleep. So we already start seeing actions with what the client reports as symptoms or difficulties and something in the brain. The other thing we see, and I've now shifted onto O1, so we're looking now at the back of the brain, is a ratio called theta beta. So we're looking at a slow to fast activity in the back of the brain. And opposite to what we want at the cortex or in the front, we want this ratio to be big. We want this ratio to sit above 2, hopefully. Anything below 1.8 to 1.8 is a red flag, and here is much below 1.8. It's actually sitting at 0.8. And even worse, when the client closes his eyes, that ratio becomes even lower. Okay, so indicating that when the client closes, can you hear me? I see someone said that the sound is very difficult to hear. I hope.
I hear okay. I'm hearing you okay.
That's good. Okay, that's good. So always let us know if there is any problem. I was just making the case when this client is closing his eyes, is actually his brain becomes even more restless, even more chattery, and that relates again to the anxiety that the client reports. So no big surprise of the difficulties that this dancer is presenting. Now related again to all of that beautiful alpha that we have seen, this artist response, we are looking at F3 and F4, so now we're looking at the frontal lobes. And we can see that there is another ratio, theta to alpha in the front. We have markers again here, and we would like ratios to sit above 1. So here, again, we have an excess of alpha in the front, which can relate to what we call frontal alpha ADD, so the inability or the difficulty to be focused, to be attentive, to complete tasks. And also, again, it's a further marker for sleep, low sleep quality. Okay. To make the profile even more full of potential, as I would say, for improvement, we also saw that his low alpha to high alpha ratio was high, indicating that his alpha bandwidth, so we're speaking about the bandwidth that goes from 8 to 12 hertz, was actually peaking in the lower frequencies rather than the higher frequencies. And this is a very important marker when dealing with athletes and with people that want to enhance their performance. We know that, and we will see that later as well, that a very important issue is the alpha peak frequency, and actually the potential related to speeding up the alpha frequency. Okay, so I think.
Thank you, Hiroko. Yeah, we will skip this break just because we lost some time with these technical difficulties, and I'm trying to do my best here. Thank you so much, everybody, for cooperating and letting me know what's going on. It's interesting that the headset that your computer was not registering, mine is registering quite well. So I don't know if it's something with your Italian computer going on out there, the stubborn characteristics, or and I think I'm probably gonna need the trauma therapy after this. But let's just move on, and then we'll see if we can answer some questions at the next break.
Great. Thank you so much also for mentioning the trauma therapy, the trauma protocol. I won't discuss thoroughly about that, but that relates to the next subject, which is something that we will see in the next slide. So we have been speaking about identifying inefficiencies. We have been speaking about the clinical cue and how that clearly details those inefficiencies and the potential for improvement in the training. Now we're going to speak about removing those inefficiencies. So the concept here, Dr. Swingle often uses the metaphor of actually making sure that the foundations are right, fixing the foundation, preparing the foundation, so that we can then build the house on safe and highly functioning foundations. So we have several ways of doing that, of normalizing and optimizing brain functionings. And at the clinic, we really have a very broad offer of tools that we can use. So I'm speaking here about brainwave biofeedback, what we can also call neurotherapy or neurofeedback, some people might call it.
we're also talking about brain stimulation, we're talking about cranial sacral therapy, and also self-regulation procedures. So in that respect, I'm also talking about biofeedback, for example. And all of these assist in correcting the inefficiencies that we have identified with the assessment. Now, Rita was talking about the trauma protocol, and the trauma protocol relates to something very valuable that we actually deliver and that we can offer at the clinic, and it's a whole concept of brain driving. Now, brain driving applies the principle of classical conditioning on brain waves, whereas neurofeedback would apply more the concept of operant conditioning. Here is really using the concept of a stimulus which is like a light or a sound that is actually conditioning the brain waves into a desired state. So it's sort of nudging the brain into a better desired state. Okay, so here is a photo that we often use just to let people see what that looks like. So we might have some headphones with the subliminal sound. We might have some goggles which are actually projecting some lights at a specific frequency. And we also have, so many things to be discussed. We also have some stimulation here of some acupuncture points. So as I say, this is a very effective and very valuable tool that we use at the clinic. Okay, I'm saying that because I'm just gonna again quickly show how what we showed earlier. So that's the 1 Hertz beams way of looking at brain waves, and this is hypothetically how the brain waves should look like. So it should look like a staircase coming down from the slower brain waves down to the faster brain waves. And here the principle is quite simple. Slower brain waves would just pass through the skull in a higher amplitudes rather than faster frequencies. So we would like to see that sort of shape. Now we know from literature that athletes or optimal performance clients very rarely apply to the concept of normality. We're going to discuss that later as well. And we see peculiar patterns, peculiar characteristics. Now here is an example of a young athlete. This is a tennis player. He's a male, 20 years old. And actually we see how his alpha frequency is peaking at 10 Hertz. I am showing these slides to relate back onto the concept of on brain driving, and I would like to show this slide because it talks about a exclusive harmonic sound that we have at the clinic. It's the Omni harmonic, and it very simply shows how after 2 minutes of exposure to this harmonic, we can see how those brain waves related to high performance actually increase. So we can see how there is a huge increase. I think it's 55, 88%, 76% in actually those good, efficient brain waves that we want to increase. So I'm speaking about 10, 11, 12 Hertz. So once we have discussed about identifying efficiencies, we have seen potential in how to remove those efficiencies. I'm now just going to concentrate on the concept of finally optimizing specific brainwave patterns. And again, we know how those brainwave patterns should look like because we know them from literature and we know them from direct experience. So having had the opportunity to work with the high performing athletes in the realm of soccer, and everyone knows how strong soccer is in Italy. We take our soccer very seriously, and I have had the opportunity to actually trained with both my father and Tim Harkness for very important football teams. So what do we want to train? And again, not one size, it's not true that one size fits all. And also, again, let me just repeat the case that brain waves which are considered normal, not always, this concept of normality not always applies to optimal for peak performance goals. So in fact, as I'm going to say later here in this slide, I'm talking about optimal. I'm not necessarily talking about better. Because the whole concept of optimal performance is actually the concept of training outside the normal range. So I know that the difference between the people who are sitting on the public and the one that is out on stage is maybe that crucial, critical 2% out of the normal range. And this is what I'm really interested in when I do optimal performance. So, for example, just to make an example, going back to the clinical cue, I am looking at the location FZ. So this is, again, at the center of the frontal cortex, and I'm looking at the ratio, which we call here the high beta to beta ratio. So I'm looking at frequencies, the ratio between 28 to 40 hertz onto the 16 to 25 hertz. And I know that normally, again, normally I would like to look for ratios which sit at around 0.5, 0.55. Now there is a whole issue here. I see in optimal performance many people that have actually a hotter, what we call a hotter anterior cingulate, a hotter level of determination. So again, this is a whole rephrasing of the concept. And there is a whole potential in, having that level of determination. High performing athletes train every day. They have a strong drive. They become extremely passionate about what they're doing, onto the the level of saying that they're a little bit obsessed with what they do. So we want to keep them onto the range of determination without moving onto the range of stubbornness, of mental rigidity, and there we're looking at ratios sitting, much higher, 0.7, 0.77, 0.78. Okay, so the next stage, we're speaking about this whole concept of determination. I'm going to go back into the concept of alpha waves, and again, I'm going to relate to data that we have collected from our experience, and maybe this is one of the, I think, the most significant, the most important slides, and I would like to thank the Team Harkness for this slide. We have actually here real data collected from our own database, and when I say our own, I don't only mean precision neurometrics, but I'm also speaking about the marriage between the precision neurometric with the whole concept of mind room and what we have been doing in the soccer field, collecting data for more than 20 years, 2 decades. So what I'm seeing here is a very important concept, not only the importance of alpha peak frequency, of alpha density, and of alpha speed, but also the concept of mental flexibility and this whole concept of shifting alpha. So let's go back to this slide. We have plotted here three sets of three groups, and we have in that light purple color first team, and I'm talking about collecting several athletes, but let's say the first team in several arenas of sports. I then have reserves, and then I have in those same teams staff. Okay, so that could be assistants working in the corporation, executives, and management, I would say. So the important point here is looking at those two groups, the top athletes, so both the purple and the red line, I can see how broader that shift is when they change the range, the type of activity. So what's plotted here is what we're going to discuss if we have time later, is the stress assessment that we use in optimal performance, and we have here 10 different activities divided between a stressor, so an active task, and a recovery. And I can actually see how the athletes excel in shifting onto mental states. So I see that their peaks into the higher alpha range are higher, really showing their ability to shift into different states. So I've been speaking about high alpha, and that correlates to a training that it's very, very important in optimal performance, and it's actually training high alpha to low alpha, and not only reinforcing those the density, the amplitudes of high alpha, but really teaching the client the ability of shifting onto in and out of that mental state. And that also is, again, the notion of shifting eyes open and eyes closed. So here I have a slide about SMR, which we consider quite an important brainwave frequency. But again, I want to make the case, we're always speaking about customized approach and really custom-made training. So we assess the client, and then we can identify where his alpha range could be sped up, and in the range of SMR or high alpha range, where the potential lies for that specific client. Okay, let me just go on, and we have lots of information, and I'm sorry that we lost a little bit of time with our technical issues, so I'm going to try and maybe cut some slides short just to focus on those that I consider more important. The second important point in optimal performance is the whole concept of self-regulation training. So I'm here talking about the importance of teaching the client important skills related to self-regulation. And I'm talking here about peripheral training. So I'm talking about measuring temperature, EMG, respiration, skin conductivity. So really teaching the client how to regulate his autonomic nervous system arousal. So here I'm just making the case for optimal performance. In the optimal performance arena, biofeedback becomes really an instrument to empower the client. So it's not necessarily a tool that the therapist uses like for a therapeutic application, but here is the individual, the client, the athlete is learning things with the help of a practitioner about himself. So here I'm talking about a very important aspect which we then use as a meta strategy, as a meta cognition, the whole concept of self-efficacy, and the importance of how much the volitional aspect of improvement can lead to outstanding results in what we're doing. Okay, so we spoke about, I just mentioned about the importance of peripheral biofeedback and how this modifies the activity of the sympathetic nervous system and the parasympathetic nervous system. So I think this is from Dr. Swingo's 2008 book, and I'm sure Rita will then mention it and give you the details, the title and everything. But what's stated in the book is actually here an important point about really teaching the client about gaining this ability to shift between the arousal and preparation state, and then onto the body calming and recovery. So it's I think it's much overly simplified, but then again, it's the old notion of brake and accelerator, and really teaching the client that he has to have both skills. And recovery is quite crucial in optimal performance, not only training. We have seen many clients, many athletes, top athletes, which are actually overtrained. So there's the whole issue of recovery, so activation of the parasympathetic system. So here there is the whole concept of the psychophysiological model of activation. So I'm talking here about the HPA axis. So the hypothalamus is connecting or communicating with the pituitary glands, and then with the adrenals, and in a what I call a stress response that would, just trigger the adrenal glands. I have a cute animation here to release what are known to be the stress hormones such as cortisol, dopamine, adrenaline, noradrenaline, and what I know to be called the generalized stress reaction. So that's quite crucial when I'm doing psychophysiology training. That's quite an important measure of all of that notion of sympathetic and parasympathetic system. The stress reaction is actually an overreaction of the sympathetic system. So I want to teach the client both to see when he's over-aroused, and I want to teach the client how to induce a state of recovery. So I see here the slide for questions, and let me just ask Rita, do you think that we have recovered time? Shall we just maybe take one or two questions, and then, because there's still so much information. And
yes, that's exactly what I'm thinking about here. Looking at the time, we'll probably have to skip this break as well, and I apologize for the time we lost with these difficult technical difficulties. But for those of you who send me the questions, what we can do, you can email them to me, and my email address, you can see it on the screen, rita@swingoclinic.com, and then perhaps Hiroko, you can respond to those questions over the email. So I think due to time, we should move on. And thank you to all of you who are sending me messages that you are enjoying this and the sound is good. So I won't get fired after all. So that's fantastic. All right, let's move on.
Okay, no, Rita, I don't think you will be fired. You're too good to be fired. And I know that Dr. Swingos is listening to us, so I'm sure he will agree. So going back to the psychophysiology arena, and going back to the issue here of custom making, of tailor making the training for every single client. We are again facing the whole issue of assessment. So how can we measure that sympathetic arousal, that or the opposite? How do we actually measure parasympathetic activation? We have again a very efficient and very interesting tool, which is the Michaelis Mind-Rune Stress Assessment, and then we can also, based on our normative database, calculate a resilience IQ, so a value which is normalized out of 100, just like the IQ, and that's also information that we can give to the client. So what do we measure? And again, you see how dense the slide is and how much information there is. So what we measure is full physiology. We have full physiology monitoring here. We have EMG monitoring. Normally we measure two. Here in this slide, we just measured one. You can see who the participant was. You can see the little picture. It was actually myself. So you can measure the two muscles at a time. Normally we measure the frontalis muscle and the right trapezius, but we can also, in the case of asymmetrical sports such as tennis, for example, we can actually assess the two trapezius, so the two shoulders, and see if there is any imbalance. We then measure heart rate, so heart rate mean and vasoconstriction. I'm gonna move my little arrow here, so how much the capillaries are dilated, so the venules in the peripherals are dilated or constricted. We measure respiration, so I'm here pointing out this red line, this red graph, and this is thoracic breathing. Blue one, oh sorry, I moved the slide. The blue one is abdominal breathing. We measure skin conductivity. This is this yellow line here relating to this value, and we measure peripheral temperature. We administer then, as I said, 20 minutes of activities. So you can see this is the timeline. You can see this is 20 minutes of activities, and the activities are divided by these white columns. So we will have the client, we will measure baseline, eyes open, eyes closed, and then we will have some stressors and ask the client to actually recover. We give the clients 2 minutes to recover. I think, after many years of having used this tool, I think it's been really optimized, and 20 minutes means 10 activities. They each lasted 2 minutes, so we give the client time enough to either be able to recover or to get more stressed thinking about the performance. Some of us were listening and that have actually taken the assessment are still thinking about it, somehow a little stressed about it, but that's exactly what we want to do. So we want to induce a minor stressor and see what the reaction is. So again, the whole concept of bouncing back and learning resilience and self-regulation skills. So our database, based on our data, we have then spotted out or traced out 4 subtypes, 4 big groups of reactions. Okay, so we have what we call the performance risk group, athletes that have an anxiety avoiding behavior, and we would see that reflected onto an elevated skin conductivity response both at baseline and during the trial. We have another group called the quality of life risk group, which is a group that actually has a decreased temperature, both baseline and values throughout the assessment, but then again with normal skin conductivity and heart rate variability values. The third one is what Tim Harkness has defined as the caged lion group. And here we see actually a decreased temperature combined with decreased heart rate variability, raw BVP, and skin conductivity, so sort of a quite flattened out reaction. And then we have the fourth, which is the ADD group. Okay, so here we're talking about a risk of performance, elevated theta to beta ratio, and I'm talking here of obviously the cortex, so measurements at CZ. So here I was just presenting, the profile. So this is from a client and from an athlete, and I see the anxiety avoiding subgroup. So I see here a very high skin conductivity baseline, okay, which the client is going to actually show and present throughout the whole 20 minutes. So when I say high, I'm talking about the skin conductivity baseline sitting at around 8.4, 8.5 micromoles. Micromoles is the unit measure of skin conductivity. That's a quite high baseline, I would say. So normally we look at the values sitting around 2. Again, it's quite a relative value, so there are many environmental components, but we can say based on observation, that 8 is quite high as a baseline. I'm just gonna go through then the challenge threat profile. So here, as I said, very low temperature with normal skin conductivity. So here, as I said, 2, this skin conductivity is what I call a normal value, but I have a skin temperature, peripheral temperature sitting at around 25. And here, I apologize for those who are familiar with Fahrenheit. So I'm talking about Celsius. Celsius 25 degrees is quite cold. Okay, it's like Rita in a cold room. Rita is always cold, but she's not at risk.
I always get cold.
Okay, then the third group is what we have defined as the caged lion, and the caged lion profile is exemplified by a profile, with, again, low temperature, so low degrees in terms of temperature. And then, sorry, we have just moved the slide. Also related to very low skin conductivity baseline. So here is skin conductivity sitting at around 1.9 is a very low baseline. So here I have indications for what I would call exhaustion marker. And most importantly, I look at baseline, but I also see that there is no response, and here I'm moving my little arrow here, when I am presenting the client with some stressors. So for example, it would be this area here, this area here, this area here. I see some activations in terms of muscles, in terms of the heart rate, but my skin conductivity line is quite flat. The fourth group, so I'm gonna move on to the fourth group. The fourth group is what I've called the ADD indicator, and here I have values of the theta beta ratio which are actually high. And then again, I have guidelines there. The Monastra, for example, the Monastra published article, I think it's Monastra 2001. We know that values sitting much below, according to age, but sitting above 2, and that we use in the clinical queue, are markers for problems in attention. Here we have the theta beta square, that's a value which has been squared, sitting at around 6.62. So that's quite a high value. Okay, that's why I am speaking about ADD indicator. Okay, so what do we do once we have assessed? I'm gonna just try and speed up to give as much information as possible. Again, I make the case not one size fits all, and I need to custom made, and I need to understand, given the profile of the client, what specific ability to train in the client, what specific approach is preferred, okay, with the client. So wherever I see that there is a skin conductivity, low response or excessive response, some issues with temperature, with muscular imbalance, then I know where to start from. And obviously, also breathing is a big issue, but you will understand that it's really beyond the scope and the time that we have available. But hopefully we will have the opportunity in the future to maybe devote a whole webcast to breathing and heart rate variability training. Okay, so going back quickly to our first case study. So this young dancer, the English ballet dancer,
I can really nicely see how his clinical cue is marrying with the profile that we get from his stress assessment, from the resilience assessment. So we see a nice marriage here with so the brain, what we see in the brain, it's all in our heads, meets up and marries with it's all in the body, and really the whole notion that the body are strictly connected. So I see here a client which presents a very high, I'm going here with my arrow, very high baseline muscular activation. So here I was measuring frontal, and that's the green value that I see here. I was measuring the right shoulder, so the right trapezius muscle, and I see that this client has a quite high baseline activation of muscles. Sorry, the slides moved again. I apologize. I see his respiration is quite shallow and inefficient, sitting at around 15 breaths per minute, both thoracic and abdominal. And I see his skin conductivity is extremely high, so his value at baseline is sitting around 7.17 micromoles. And not only that, I see his responses are quite intense to the stressor. So this is during the mathematics task, and this is during a stroke task. What I see, so this is not necessarily something to be worried about. We want the client in general to be responsive to a stressor, but what we want to also see is the ability of the client to actually then have a very efficient recovery in terms of skin conductivity. And if I compare the baseline, I can read the value, as I said, 7.17. I go back here and I can see that it's at the end of the assessment, it's sitting at around 12 micromoles. So I have a big accumulation of arousal there. So there's a whole potential of training and teaching that client how to actually learn skills, how to improve his recovery skills. Okay, we're almost done. I think we recovered somehow the times that we had lost. I want to make the third point. The third point is, once I have identified the brainwaves that I want to optimize, once I have optimized them, I have looked at the self-regulation skills, physiology. I am starting to have a very nice model of optimal performance, a model that is based on the whole system, really the notion of this interconnectivity between brain and body. I can then optimize, I can then maintain that state. Okay, so once a state of coherence has been achieved, a state which is a natural state, and where I'm feeling that I am in a state of well-being, that I'm doing what I like to do, I then want and maintain that state. So I want to provide the client, for example, with data-driven, data-informed daily brain exercises, for example. But I also want to really encourage the client to undergo periodic brainwaves, and why not peripheral therapy, or we here use the word therapy, but we could easily say training. Okay, so again, going back to the Swingal's book, increasing optimal functioning of the brain means increasing efficiency and intellectual performance. And that includes the whole concept of tuning up of the brain. So the notion is, yes, once I have achieved a result, that result will be lasting, but also I might want and fine-tune, keep the brain fine-tuned. Maybe, we see our clients twice a year for a fine-tuning meeting, for a checkup, the whole reassessment, and really the fine-tuning, keeping up with with those nice achievements that we have achieved. So I'm talking here about, for example, age-related decline, or what we have rephrased it, optimal performance for the wiser. But also athletes, before performances, we see them coming back and intensify their training just right before their performance. Okay, so I think I have sort of discussed what I wanted to share with you for today, and I'm just gonna let space now for Rita to, as I had asked, to talk about the book, which I have been mentioning during the speech, and I'm thanking you for now. Rita, it's up to you.
Thank you, Hiroko, for a great presentation. I'll just go through this fairly quickly. I'll just do a little bit of promo and events. I'll mention some events that we have coming up. So this is the book I mentioned at the beginning, Biofeedback for the Brain, by Dr. Paul Swingle and published by Rutgers University Press. And if you are interested in learning more about neurotherapy, this is really a must-have item. You can order it online at www.soundhealthproducts.com. And this is a book that was written by Dr. Swingle for therapists. It's called Basic Neurotherapy, the Clinician's Guide, and it leads clinicians through the procedures for evaluating and treating patients with wide range of disorders. It is also available at soundhealthproducts.com. Swingle Clinic has many educational offerings for both professionals and general public. These include public lectures, webcasts, grand rounds, online consultations, courses, and workshops for professionals. The next workshop that will be presented by Dr. Swingle is coming up in April. You can see the dates on the slide, April 12th to 14th. It will be Clinical Q and Brain Driving Fundamental Neurotherapy Workshop for licensed healthcare professionals. And we will then do the same workshop again in June 21st to 23rd. And we'll be following that with our advanced workshop, which will be in October, specifically 4th to 6th. If you have any questions, please feel free to email me at rita@swingleclinic.com. Another workshop that we have scheduled for this year is for practitioners interested in utilizing and integrating two very effective treatment modalities. It's the emotional freedom techniques and hypnosis. The workshop will be 80% hands-on and 20% didactic. It will be presented by Dr. Lee Poulos, a clinical psychologist and clinical assistant professor emeritus in the Department of Psychiatry at UBC. The workshop will be offered on Saturday, April 27th here at Swingle Clinic. And on top of all the educational programs we have here at the clinic, there are also grant round sessions, courses, and webinars administered by Biofeedback Foundation of Europe. The professionals who complete these courses are eligible to receive APA continuing education units. More information can be seen at BFE's website at www.bfe.org, or you can also email Dr. Swingle's team that he has at BFE, and the email address is blueswingle@gmail.com. And that concludes today's webcast. It's all in your head. We hope that you enjoyed it despite all the technical difficulties, but it seemed like towards the end it went quite smoothly. Feel free to send any comments or feedback to me, again, at rita@swingleclinic.com. We will be back next month to talk about seasonal affective disorders. So have a great weekend, everyone, and enjoy the sunshine. Bye-bye.
Enjoy. Bye-bye.
Thank you, Hiroko.
Thank you, Rita. Bye-bye.